نكمل محاضرة الانفلاميشن. Oxygen derived free radicals at low levels, at high levels. At low levels, increase chemokines, cytokines, adhesion molecules. At high levels, endothelial damage and thrombosis, protease activation and inhibition of antiproteases, direct damage to other cells. Protective mechanism against free radicals include transferrin, ceruloplasmin, catalase, superoxide, dismutase, and glutathione. Morphologic appearance of acute inflammation. Catarrhal, acute inflammation plus mucus hypersecretion. Common cold. Cirrus, abundant protein, poor fluid with low cellular contents, skin blisters, and body cavities. Fibrinous, accumulation of thick oxidate rich in fibrin, may resolve by fibrinolysis or organize into thick fibrous tissue, acute pericarditis. Morphologic appearance of acute inflammation. Suppurative, purulent, pus, creamy yellow or blood-stained fluid consisting of neutrophils, microorganisms, and tissue debris, acute appendicitis. Abscesses, focal localized collection of pus. Empyema, collection of pus within a hollow organ. Ulcers, defect of the surface lining of an organ or tissue, mostly GI tract or skin. Subcutaneous abscess، خراج تحت الجلد. Lung abscess، lung abscess. Fibrinous pericarditis. Gastric ulcers، gastric ulcer. Foot ulcer. Burn blister. Outcome of acute inflammation: complete resolution, back to normal, clearance of injurious stimuli, removal of the exudate, fibrin, and debris, reversal of the change in the microvasculature, replacement of lost cell, regeneration, healing, organization by fibrosis through formation of a granulation tissue, substantial tissue destruction, tissue cannot regenerate, extensive fibrinous exudate, abscess formation, progression to chronic inflammation. Complete resolution of inflammation: blood vessel, neutrophil monocyte, fluid and protein, lymph, macrophage, neutrophil monocyte, neutrophil apoptosis, macrophage, necrotic tissue, debris, growth factors, repair, fibroblast, repair. Outcomes of acute inflammation: acute inflammation, unusual result resolution, pyogenic organism, abscess formation. الابسس formation تتحول إلى lead to repair and organization fibrosis. أيضا عندنا excessive destruction repair and organization fibrosis, chronic inflammation fibrosis. Acute inflammation persistence, chronic inflammation fibrosis تليف. Effect of acute inflammation beneficial, harmful. Elimination of injurious stimulus, dilution of toxin, entry of antibodies, drug transport, fibrin formation, delivery of nutrients and oxygen, stimulation of the immune response. Harmful, digestion of normal tissues, swelling, inappropriate inflammatory response. Chronic inflammation, inflammation of prolonged duration, weeks, months, or years that starts either rapidly or slowly, characterized by an equilibrium of persistent injurious agents, inability of the host to overcome the injurious agents. Chronic inflammation characteristics: chronic inflammatory cell infiltrate, lymphocyte, plasma cell, macrophage, tissue destruction, repair, new vascularization, fibrosis. Acute inflammation versus chronic inflammation, the duration minutes to days, the duration days to years, predominance of neutrophils, predominance of lymphocyte and macrophage, fluid and plasma protein exudation, vascular proliferation and fibrosis. Chronic and acute pneumonia. Chronic and acute pneumonia. Chronic inflammation, under what circumstance does it develop? Progression from acute inflammation, tonsillitis, osteomyelitis. Repeated exposure to toxic agents, silicosis, asbestosis, hyperlipidemia, viral infection, persistent microbial infections, mycobacteria, treponema, fungi, autoimmune disorders, rheumatoid arthritis, systemic lupus erythematosus. Macrophage and mononuclear phagocytic system. Macrophages derived from circulating monocyte, scattered in tissues, cover cells, liver, sinus, histiocytes, spleen, lymph node, alveolar macrophage lung, microglia CNS, activated mainly by IFN gamma secreted from T lymphocyte, increased cell size, increased lysosomal enzymes, more active metabolism, greater ability to kill ingested organism, epithelioid appearance. How do macrophages accumulate at site of chronic inflammation? Recruitment of monocytes from circulation by chemotactic factor, chemokines, C5a, PDGF, TGF alpha, fibrinopeptidase, peptides, fibronectin, fibronectin, collagen breakdown fragments. Proliferation of macrophage at foci of inflammation, immobilization of macrophage at site of inflammation. Products activating macrophage, proteases, complement and clotting factor, oxygen species and nitric oxide, amino acid metabolites, interleukin 1 TNF, growth factors, PDGF, FGF, وTGFB. Role of activated macrophage in chronic inflammation: immigrating, circulating monocyte, adherent, immigrating, tissue macrophage, non-immune activation, endotoxin, fibronectin, chemical mediators, activated T cells, cytokines, activated macrophage, tissue macrophage تحول إلى activated macrophage, tissue injury, fibrosis, toxic oxygen metabolites, proteases, neutrophil chemotactic factor, coagulation factor, amino acid metabolite, nitric oxide, fibrosis, growth factors, fibro fibrogenic cytokines, angiogenesis factors, remodeling collagenase. Macrophage lymphocyte interaction: activated macrophage, activated macrophage, interleukin 1 TNF, present of antigen to T cells, lymphocyte, activated lymphocyte, other inflammatory mediators. Complete resolution of inflammation: blood, fluid protein, neutrophil monocyte fluid, fibroblast, repair. Granulomatous inflammation, a distinctive of chronic inflammation characterized by collection of epithelioid macrophages. Granuloma, in addition to epithelioid macrophage, may have one of or more of the following: a surrounding rim lymphocytes and plasma cells, a surrounding rim of fibroblast and fibrosis, giant cells, central necrosis, caseating granulomatous in TB.